All right, guys, let's go ahead and let's talk about evidence. I
You want
got
to
a
move it
little
too
bit of a
much?
hot one today.
Yeah, your gears are grinded. No, you know what really
I'm
grinds
not
your
so much
gears? There you
grinded.
go.
I guess I'm just irritated that this exists out there a little bit. I'm a little irritated. I see the
Well,
benefit. Don't get me wrong. I see the benefit of why it's out there in a way, but it grinds my teeth a little bit. So.
today we're gonna be talking about evidence-based practice, the good, the bad, the ugly, and Laura's story of what happened. So let's go ahead and jump right in.
Let's go.
You're listening to the PT Assistants Podcast with your hosts, Ken
and Laura. Thanks for joining for another exciting episode. All right, guys. So I figured we just jump right into it with a little bit of a story time. So this kind of recently came up where I hadn't heard of it before, but apparently there is like a questionnaire that you can give patients and kind of have them fill it out. And if they score high on it, you're supposed to avoid any type of manual treatment for them, and they are supposed to be more recommended to mental health type treatments. They think it's more of a, oh gosh, Ken, what's the word I'm looking for? Type of treatment, a type of
A
problem. Not an actual physical problem, but a
psychological,
thank you.
psychosomatic.
Psychosomatic problem.
I got you.
So
Don't worry.
it came up.
I'm here.
The reason this came up is because I have a patient who I think would benefit from dry needling. He is chronic lower back due to post-op of a lumbar fusion. Still has to have tightness as his main problem, along with pain. His left side is the worst, and me palpating, you can feel quite a few little spasms in there. And like you work on it and he feels better for a little bit of time, but it's not lasting because it all just tightens right back up. He has apparently been diagnosed with clinical depression, which technically I didn't realize this when we were talking about it, but I brought it up to my PT about how I thought maybe he might be a good candidate to try dry needling with, because she recently just kind of started doing it. And then that's when this kind of came up of the questionnaire. And at first I was like, oh, that's interesting, kind of cool. But then I started really thinking about it, and I was like, are we relying too much on like questionnaires and some research that's been out there to really judge what treatment we are trying and not trying? Because I think about personally myself. Let's just be honest here. Like if I was to take a quiz right now on certain things, like for example, soft tissue work, if I thought I needed it for my foot, let's just be honest, I'd score off the charts probably for that thing, because it is one of the things that will give me relief, not permanent relief, but it gives me relief and relief from my pain, and does help mentally at the same time with it. And I'm like, but at the same time, does that mean that I shouldn't get that treatment because I would score high, even though it could benefit me? And so it kind of just started me thinking down this path of like, when do we rely too much on research and not enough on our actual clinical judgment on when to try different types of treatments, if that makes sense?
It does. I was just letting you do your
I
thing.
know. It's kind of like, I know, a little bit long, but that's kind of what started it off, was that whole conversation. And I don't know, I have a hard time kind of accepting a questionnaire that someone would fill out um, for a type of treatment that we might think that would be benefit for them.
I don't know. Sometimes I feel like this whole field is like, oh, let's just like we do have like a plan of action, and then sometimes it's like, well, none of this is working. Let's try something else, right?
Mhm.
And the hard part of trying something else is if it's not backed up by evidence, do you even give it a try? Which it seems like that's kind of the boat that you're in. And
Well,
I was trying to look up
kind of.
the test that you're talking about, and I couldn't find it. And then I was trying to look up there's like this giant sheet of every single type of modality that we do, and then it gives that modality a grade on effectiveness.
Ooh, interesting. I want to see the sheet.
So I'll have like low back, we have like low back pain, and then I'll like first I'll have the diagnosis, and then I'll tell you tractions, heat stem, manual therapy, dry needle, and then I'll give it like a minus, a B, a C, and it's just saying how much evidence is behind that sort of treatment. And as effective as I feel like it is, it's just like that thing of like, well, when do we try something different that's not part of that list? You know what I mean?
Yeah, that doesn't get, like, an A on that list because, like, at the same time, I'm like, even if each person we talk about this all the time. You say textbooks don't read or bodies don't read textbooks, which by the way, I steal that and I tell my patients that now too. But,
Uh,
and we say that every person is different. Why are we trying these evidence are usually based off of masses of what will work with the mass, but you're going to get those cases that are going to be one-offs that don't fall under the mass of this is going to work. And maybe something else does respond better for them. Not everybody responds great to heat. Some people hate that feeling in general. So as much as we say, heat is, we'll just say like, I don't know the list. What is it grade? Does it have it on your list? Does it
for
say on
heat,
there? Yeah.
or I would have to like specifically find it.
Yeah. Well, we'll just
Flexion
go with like
exercise got a
say,
C. Trunk coordination. Yeah, there's like a whole like it's pretty extensive.
we'll just say you got a B. We'll just assume, right? I'm
Okay,
gonna give it a B.
go ahead.
So say it has a B. But, that person's not gonna respond well to the heat because they don't like it at all. It could make them tense up more, it could make them even more stressed within their body, which we know doesn't promote healing. So it's like just because that modality technically has a really high grade does not mean that's gonna work for that person.
I always
Um
think back to like the patient that I had that has MS.
Mhm.
So MS usually is heat intolerant, and I had a patient that loved it. Like you covered his whole body in heat, but textbook
Yeah.
wise, you're not supposed to do that. But he found relief. He enjoyed it. He feels like it helped, so we did it.
Yeah, so I guess I just it concerns me sometimes when we base all of our judgment based off of too much, research in a way, because at the same time, some of these researches, they're still fairly new. Yeah, it's been researched and that study maybe was great, but how many other studies have been done with it? Recently someone had mentioned that they had taken a class and they were like, "Oh, we were told not to do this unless this, and this don't work." And it's like, "Okay, well, you know, what makes it that person's thing the way to do it in a way? Like why is it that set that way? Because I've heard other ways. Um and it's like kind of like when do we I'm just like I'm not saying research is bad. It's just when do we decide to forego the research and use our clinical judgment, which I think that's how it should be. I don't to me, I have a really hard time doing a test on someone and choosing not to do a treatment that possibly we think could be beneficial just because they got scored high on wanting the treatment done. Does that make sense? Like I have a really hard time wrapping my brain around that. I can't get through that. Cause like,
Uh,
yeah, I don't see them going separately. Like if you have, and I guess maybe this is just because of the fact that I'm a person who has experienced very long chronic pain at this point, and we're going on 3, 4 years at this point for me from the initial start to where I'm at now. And I'm like, yes, there is some mental stuff there too. Don't get me wrong, there is some mental stuff. And then the longer the pain goes around, and if you don't have a good support system, that really can bring you down. I like to call it the chronic blues. You're going to get that no matter what at some point, whether you are depressed or not. You will have a point where you will get hit with the chronic blues. And I'm like, if you give that person like a test at that point in time, even though they're not actually depressed, they might not get a treatment that they need because it's just showing, based off of how they feel at that point in time that they shouldn't get it. Does that make sense?
it does, but like as far as the thoughts of modalities that don't have too much research themselves, kind of like the cupping, theragunning. things like that. Like, should we avoid those too, or do those like? Would you still use your clinical judgment on whether or not a patient would benefit from using a hypervolt, for example?
I think so. I think you gotta use your clinical judgment. That's where we become skilled. That's where, we become important in their treatment process. Not everything is gonna work for everybody. We know this. In general medicine, that's why not every single surgery goes perfectly, even if it's performed perfectly, the outcomes aren't exactly the same, because everybody is so different. And yes, there is the norm, but then there's things that fall outside the norm, and we need to be creative with our how we treat in a way. And I think that's the best part about it. It's like we can't just follow these strict guidelines of yes, this, and this. We need to use our clinical judgment on whether or not we actually feel like it would be beneficial for the patient. And like that's the thing is like I guess I have a hard time with it's really this questionnaire I really can't wrap my brain around because I'm like, I'm physically feeling it. Like, I physically can feel the spasms in their back, and I know how tight they are. I know I can loosen them up, but they're not going away. And it's like, I physically, I'm legit the one who's like, I think this would be up. The patient had no idea about it or anything like that. Like, I'm the one who brought it up with my PT and said, hey, I think this could be beneficial. Um, Because you know how it is, those spasms are so hard to get rid of sometimes, and dry needling has shown to be so good at kinda hitting that reset button for those ones that have chronically been there for so long. Um, and so it's just kinda like one of those things where it's like, w why does there need to even be that questionnaire in a way? Like, I could get maybe, like, the patient comes in and right off the bat is like, "I can only have this treatment, and I can only do this and this because this is the only thing that works for me," then I could see it. But if it's just trying a new technique, like, I feel like that your clinical judgment should be the one that's deciding that, not research,
Not the questionnaire.
not a questionnaire. Yeah.
No, I agree, and I feel like it's also. I mean, to me personally, I feel like it would at least be worth a try, unless there's
Mhm.
like some hard contraindications where it's like,
Yeah.
oh, you can't perform on them because of the surgery or because of this or because of that. Then
Or
I
location or
understand,
something like that.
or the
Yeah.
location, but I mean, unless like the money is a barrier or the insurance is a barrier or whatever else the case may be, like I feel like it's still worth a try. But then again, that's just my opinion. The
Oh,
PT
yeah,
that
this
I've
is all
worked
my
with, he
opinion.
does dry needling on. If someone has a headache, then like, all right, you want to give it a try. Like it's almost like you have certain symptoms. Are you willing to give dry needling a try?
Yeah,
But
which
then he
I
will say
like,
no to some
again
cases, depending on where it is and what they're feeling, because he won't dry needle everybody for like the
yeah,
same issue. It just kind of depends on per patient, what's going on, and if he
what
feels
he
like it
feels.
truly will be beneficial.
Yeah, and it's interesting because of the fact that, like, I've worked with that same PT, and now it's kinda just, like, opposite where dry needling is almost looked upon as, like, a last resort option in a way, um, which I find kinda interesting because I'm like, I don't know, to me, if you're responding well to soft tissue and you're definitely in chronic and you're feeling it and it feels like, hey, I think dry needling would help with this. I feel like dry needling is going to knock it out much faster. And this, again, personal experience will knock it out much faster than if you were just to do, soft tissue for like 5 more sessions type thing. Um, so it's definitely interesting now. I'm curious on your point of view because you get both sides a lot.
Uh, And yeah, so that's the hard part for me because I practice with two PTs, one which is extremely on the evidence based practice side, and then the other side, which is, well, if it makes you feel good and you feel like you're finding benefit from it, then go for it. So, like, the things that come
Yeah.
to mind are the cupping, or the Theragun taping, whether it's like the voodoo taping or the kinesiology taping and things like that. And we even have patients ask us, hey, I found this thing online. It says it'll cure my headache or it'll get rid of my neck pain. Do you feel like have you heard of it, or do you feel like it would help me? And I mean, we're kind of like quick thinking about, oh, what's it for? What's it do? We'll kind of explain why they're making those claims. And
Mhm.
one will completely destroy it apart, while the other is like, hey, if you want to go for it, give it a try. And if you feel like it helps, then that's great. Then keep doing it.
Yeah.
Because a lot of that is like meant, like, well, I guess not a lot of it, but sometimes it is mental. Like it is, if you feel like it's helping you, then the pain will go or lessen or go away, whatever the case may be. But for me, it just gets difficult because it's like, how should I practice? Should I, when I see the patients with are more evidence based, just kind of keep it evidence based? And then when I see the other PT's patients, should I kind of go more towards the taping and the Theragunning and all that? So it's like I
Mhm.
have to differentiate myself. Like, all right, whose patient is this? What would they want to do? Because I know for a fact if I tape one of the other PT's patients, he's not going to be happy about that.
Well, as he said one time when, we had a patient request it, he goes, "You can do it because 'cause I'm not doing it," and he goes, "And, just let them know I won't do it."
Yeah, so
So
like
they'll
I would
only
have
get
to
on
step
the
in and
days you're coming in.
yeah, so it's just one of those things where it's like I feel like a lot of the way you practice is definitely brought on by the PT you're practicing under. So if you
Mhm.
have a PT who, for your case, is a lot of evidence based, if this was your first PT, then you might be more
You
underneath
might
like,
structure your views that way a little
yeah,
bit more
you'll
too.
for sure.
Yeah.
Since you've kind of worked with multiple PTs, you have viewpoints from a whole bunch of like a variety of PTs.
Mhm.
So I think
Well,
it's
and I
definitely
think
good to keep an open mind as far as practicing. And I fall under the spectrum
agreed.
of if you feel like you're finding benefit, then go for it.
Yeah, and I'm with you on that. Like, I'm kind of more of that. And I think, like you said, I've worked with multiple PTs, one mainly direct for a good chunk of my career. But I've also been in the field for a good chunk of my life in general. I got to watch my mom, who really wasn't evidence based at all. I don't know the last time she read an evidence based article or anything like that. But hers was more off of her instinct and what she knew and um what she's done with her history. And then the one I have now, like I don't want her to seem like she's super evidence-based, but she's a there's certain things. She's a little mixed. She's kind of the same way where, she's like, "Normally, I don't take patients." She's like, "But on occasion, sometimes I'll give it a try just to see if it's gonna help them." She goes, "I think it's more placebo than anything," but, like, so she's willing to give things a try, and, so I don't want anybody to think that, like, I'm trying to come down or anything like that because she's absolutely amazing. Um but it was interesting to see that that's out there, and I guess my concern is sometimes that we almost as a field, we're going towards that a little too much versus relying on our actual clinical knowledge that we have learned over the past year, because let's just be honest, we talked about this before, is being smart or being more like, what do we say, book smart or clinical smart? Which one's better in a way?
Or like knowledge and experience.
Or knowledge and there we go, that was the words I was looking for. Knowledge and experience, like, which one's better? And this in this case, I think this is where your experience really comes into play, and that what makes you great, is being able to determine when to kinda try something off the beaten path. My big concern with just this one, uh, score sheet or whatever is that we won't do things that we feel are necessary just because someone scored high.
Or
It'll
just
be
like,
interesting.
or the potential to find benefit from an intervention because of the quiz.
Yeah, and I think that's just where I'm concerned, where I'm like, oh, I feel like that should be your clinical judgment. Um, in general, like, if your PT will allow certain things and you wanna try something out, like, honestly, if my PT, she's awesome. She does let me kinda take a little bit of the reins. She definitely likes to be involved, which is I'm okay with because I've worked with some PTs who don't wanna be involved at all, and it drives me up the wall. Um, but, so she if I really wanna be like, "Hey, I would really like to try this on this person," most likely she might have an opinion about it, but she still might let me try it. And that's where I feel like on us, like, we need to use our clinical judgment over just straight up research sometimes. Because I'm like, if it's not gonna hurt the patient and we don't think it's gonna set them back in any way or anything like that, why not give it a shot if they're not improving? What's the harm in it?
Well, I mean, I agree. I'm gonna tape somebody or
So
cup them just to see if it helps. If it doesn't, then no harm, no foul. But then you run into the issue not for like the dry needling, but the other interventions that aren't backed by evidence is the whole
mhm.
insurance claim thing.
Yeah, you do run into that.
Because there are insurances that won't reimburse you for certain techniques that aren't backed up by evidence. And I feel like a
Mhm.
lot of the evidence is whether it's new or whether it's just not completely out there yet. Like maybe down the road we will be more accepted or maybe not, who knows. But just be mindful of the techniques you're using now because some insurances won't reimburse for that.
Yeah, which at that point, if you really wanna try it, you're kinda just doing pro bono to try to get the patient better. You have to look at it that way. And if your company's cool with it, cool. If they're not, you gotta
Tread
watch
lightly.
it. Tread lightly, check in with your company, or you mix it in with a little bit, like, okay, say you wanna try one technique that's not covered, um, maybe you spend, like, a couple minutes on that technique, and then you do a technique that is covered, that patient might still find beneficial or something like that. Um, so it's definitely it just got me thinking more than anything, and, I don't know if I guess from my, like, personal point of view, which all of this is my personal point of view, but when I kinda just heard about that, it kinda, like, irked me on the inside, which I don't think should by any means, like, that was kinda her intentions or anything like that, but it was just kinda like, "Dude, I wouldn't be getting treated." Like, for example, I'm still waiting to hear back from insurance to see if I get approved for this, new procedure coming up, but technically I've been cleared by doctor, but if I took a test right now on whether or not I really wanted it, I'd be scoring very, very high, I guarantee you, and it's like, okay, would I not get that even though surgically, physically, there is great reasons to get it done and it's backed, but because I scored high on something that I'm struggling with a little bit more mentally or something like that, like, I shouldn't get the physical treatment? And I think that's the puzzling question for me. Does
No,
that
I
make
mean,
sense?
yeah, I can see what you mean. I don't think like
Yeah.
personally I can speak on that behalf, but I can see why it kind of irks you, especially
Mhm.
if it's something that could be beneficial. And again, like if there's no contraindications, why not give it a try?
Yeah. Yeah, and, like, I'm the type of person I've tried everything,
You
and
really
so
have.
it's just
They've really
I
thrown
really
they've thrown everything at
like,
you.
literally list some the only thing I have not tried is PRP, and everybody's just told me it's pretty much gonna be a waste of my money.
Yeah, 'cause
Every
that's not
single
covered by
doctor pretty
insurance.
much. And yeah, because it's not covered by insurance and everybody's like,
Well,
"Eh,
maybe we should do an
the
episode on
research is not
PRP.
great." Yeah. But, yeah, so I guess my concern with that is just, like, it started raising the question of is, like, we just need to be careful, and again, that's just my opinion. I think sometimes as people come right out of school, we're really taught evidence-based, 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 and research and research and research. But it just kind of makes me like be like, okay, as you go along though, really use that clinical judgment as you start to get it and trust your gut and your actual skills of treating. And if you have something in question, like ask someone else and run it by them, see their thoughts if you're kind of questioning it, yes or no. Because I would hate for someone to miss something that possibly could actually help, um, because of a kind of an subjective scoring method, I would say. I would say it's subjective, but
No, I agree. I don't really.
because it's all based when you're doing that one, it's all based off how you feel at that point in time.
I feel like it just comes a lot down to communication, knowing the PT that you're working with, and
Mhm.
kind of going from there. But as far as everything
Yeah.
else, no, I'm on the same boat.
Yeah, don't get me wrong, I still like research, guys. I actually really enjoy it.
You do what?
I
Like, I mean,
do,
I know PTAs have been practicing for a very long time, and they're still very uh, evidence based as far as their treatment goes, which is great. I mean, everything's proven, it's effective. But down the road, we'll see if there's other treatments that are proven to be more effective. Science is changing, so
Always
we just
evolving,
have
always
to
evolving.
keep up with the evidence as it comes out and not be stuck
Mhm.
with old evidence.
Yeah, and I think being willing to try old things and new things. Again, like Ken says all the time, bodies don't read books, and
It's
so,
so hard to coin that phrase because I wasn't the first one to said it. I do like that statement though.
I know. Well,
It blew my mind the
that's
first
why I
time I heard it.
say
I was like, wow, I like it.
well, that's why I always say, as Ken always says, because you just always say it. I didn't say you coined it, but
It is a good phrase though.
um, and so like I think that's the best thing about like I think about why I got into this is because it is a puzzle. Each person's kind of like a puzzle, and so we just have to figure out what pieces work right, and that's where our we get to use our skills and our brains and all the stuff we worked really hard for in school. Really hard for
Right? Go
and
through the
over the
program,
years.
go get through the test. No.
Yeah, and so I I wanna just encourage everybody if you're doubting your skills or you're doubting your, um, clinical judgment in a way because of what some new research says, I say keep it in mind that everybody's different and, the research isn't gonna be right for everybody. Um, it might be right for the mass majority, but it might not be right for one. So, keep that in mind.
All right,
But I
well,
think that kind of
yeah, I was about
wraps
to
up
do our little
today.
outro. Okay,
Yeah.
with all that said, be sure to follow us on Instagram. Check out the YouTube. Kind of let us know what you think as far as evidence based, and if you have any stories where you went outside the norm and it proved to be effective, we'd love to hear it. And
Hmm.
until then, we will catch you guys next week.
All right. We'll talk to you guys later.
Take
Bye.
care.
The information in this video or podcast is not intended nor implied to be a substitute for professional medical advice, diagnosis, or treatment. All content, including text, graphics, images, and information contained in this video or podcast is for general information purposes only and does not replace your professors or a consultation from your own doctor or healthcare professional.